Welcome to Beltline Bariatric and Surgical Group's online seminar for the surgical and non-surgical treatment of obesity. By just being here today, you are beginning a new chapter. This seminar is the first step on a life-changing journey to regain control of your life and your health. We truly understand how frustrating it is to try time and time again to lose weight, only to regain the weight or gain even more weight. Like many people, you've probably tried many weight loss methods without success. So what will be different this time? Dr. Proctor and his Beltline Bariatric team have a strong track record of helping individuals overcome obesity, and we can help you using proven weight loss treatments combined with excellent support and compassionate care. It is possible to dramatically change your life for the better. Our practice is not only dedicated to helping you achieve your weight loss goals, but to resolving and preventing medical conditions caused by the disease of obesity. We feel strongly that we are only successful if our patients are successful, and this is how our practice continues to deliver exceptional care to our patients. Beltline Bariatric will provide you with everything you need to succeed, including resources for nutritional counseling, a psychologic evaluation, exercise physiologists, and support groups. You are in extremely good hands with Dr. Charles Proctor, our highly trained, board-certified surgeon. Dr. Proctor uses his top-notch skills to produce the best results for his patients. He is one of the first bariatric surgeons to adopt the fully robotic approach to the Roux-en-Y gastric bypass and sleeve gastrectomy. He has successfully been performing bariatric surgeries since 2007 and has been providing outpatient sleeve gastrectomies for self-pay patients throughout the Southeast since 2014. Besides performing initial weight loss procedures, Dr. Proctor also performs revisional bariatric surgery, including gastric band conversions to bypass, sleeve, or switch, and sleeve conversions to bypass or switch. Dr. Proctor and his team subscribe to the highest medical standards and are associated with the most highly regarded medical societies. With Beltline Bariatrics, there are no compromises when it comes to you and your health.
Good morning.
Good morning. How are you doing, Dr. Proctor?
I'm doing fine, Mr. Cato. How are you doing today?
It's good to see you.
This is an ongoing relationship. I tell the patients when I first meet them, this is like a marriage. You know, the idea here is for once you and I enter into this contract together, we're matched for life. I want you to keep coming back to me. It's about continuing to be conscious of how much food am I taking in? When is it okay to stop, right?
Exactly.
I often tell patients that the reason why we have a program structured as we do, with so many parts in place, so many checks and balances, so many lead-ins to surgery, the reason for that is because we want you to be successful.
Hey, Mr. Cato.
Hey, how are you doing?
How are you?
Doing great.
Good to see you.
Dr. Proctor, him and his staff has been nothing but the best. They're easygoing. They work with you. They're very nice people. You can't ask for no more.
Step up, and I'm gonna take your weight, okay?
I think the most important things for patients to realize is, I'm their surgeon. I care about their outcome, but I'm a regular person. I have a wife, I have 3 kids, I have a little dog. I do the same things that they do at home. When I come to work every day, my job is to look out for them in their care. Patients very quickly realize what a family environment this is, how deeply every single member of the staff cares about them and their outcomes. They will get that feeling from the very first contact.
Like, that's the best part of this entire thing, is that when you walk into the office and they've seen you at 500 pounds and then they see you at 230 pounds, like, it's amazing to see someone's face light up. And that's really cool, to have that kind of staff and relationship.
But when I have patients who are losing weight, who love the practice, who have established new lives, are doing things they've never done before, and they're going out in the community and they're saying, oh my gosh, I can't believe life can be like this, it makes us a very successful practice, and that's what we want to be able to do for patients all over Georgia.
There's a lot of things I couldn't do then that I do now. And it's great. Life is good.
We've had the patients who, were waiting on a kidney transplant or a heart transplant, but were too heavy to be listed, that we've been able to get some weight off with the weight loss surgery, and all of a sudden, next thing you know, we get a phone call and, hey, I just got my kidney. My husband's going in, he's going to get his heart transplant now, and that's just, it's a wonderful story. It's very fulfilling, but I'll tell you what's almost as fulfilling as that. A patient that says, I got to go to Six Flags and walk around with my kids, and I didn't get winded. I got to ride the rides that I've never ridden before because I actually fit in the car now. Now for the first time, they've been able to do this and they feel good about themselves and they're able to live life again. That's why we come to work every day.
I will always come back and see Dr. Proctor because I want him to see my progress. I want to be able to talk to him down the line about any challenges I may have, or just say, hey, everything's amazing and you helped me get there. Thank you. You changed my life.
Keep in mind, this seminar is a great starting point. However, it is just the beginning of your journey. You will learn all the information you need to know throughout this weight loss process. This seminar does not take the place of consultations with your surgeon and team. If at any time you have any questions or concerns, always contact our healthcare team. Your weight loss treatment options and what to expect with each procedure. Bariatric surgery can be performed using the open or laparoscopic approach. With the laparoscopic method, the surgeon makes an average of 5 to 6 small incisions. The largest of these is only about 1.5 inches wide, and the others measure about 1/2 inch each. Advantages of laparoscopic surgery: quicker recovery, less pain, less wound complications, shorter hospital stay, reduced scarring. In an open or traditional approach, the surgeon makes one long incision, leaving one large scar. The recovery time is longer, and there's a higher chance of hernia or infection. Our goal is to perform all weight loss surgeries as laparoscopic procedures. It is important to note that in rare cases, a laparoscopic surgery may need to be converted to an open surgery. Causes for this could include superobesity, which makes surgery more challenging, a previous stomach surgery, or a complex medical problem. Here are the primary risks associated with any surgery: adverse reaction to anesthesia, infection, bleeding, blood clots, death. Rare. The risk of bariatric surgery is similar to the risk associated with gallbladder surgery. All surgeries have risks. However, the evidence shows an individual is more at risk staying morbidly obese than having weight loss surgery. Let's now discuss your treatment options. The sleeve gastrectomy, also known as the gastric sleeve or sleeve, is a commonly done procedure which permanently removes about 80% of the stomach, leaving a thin sleeve of stomach or small tubular pouch resembling a banana. The sleeve helps with weight loss in 2 ways. The small stomach pouch or sleeve holds substantially less and restricts the amount of food that can be consumed. When the larger portion of the stomach is removed, the hunger hormones that signal the brain you are hungry are decreased. With less hunger, you'll eat less and be satisfied with a smaller meal, resulting in greater weight loss. Advantages of the sleeve gastrectomy include no foreign device inside the body, no rerouting of the intestine, rapid and significant weight loss, effective in improving or resolving type 2 diabetes. Disadvantages of the sleeve gastrectomy include irreversible procedure. Part of your stomach is permanently removed. Potential for long-term vitamin deficiencies. patient must take vitamin supplements for life. GERD, also known as reflux, may worsen. Sleeve potential risks and complications include internal leaks at stomach staple line, strictures, narrowing or pinching of the sleeve. Roux-en-Y gastric bypass is one of the most common weight loss surgeries. In the gastric bypass procedure, a small stomach pouch is created by separating the top part of the stomach from the rest of the stomach. The small stomach pouch, about the size of a golf ball, is reconnected to the lower portion of the small intestine, bypassing the rest of the stomach and the first part of the small intestine. The remaining portion of the stomach is left in place, so your body can continue to make digestive juices that are needed to break down food. These digestive juices go from the larger part of the stomach through the bypassed small intestine to mix with food in the lower intestine. Gastric bypass works in several ways to help you lose weight. A smaller stomach limits the amount you consume, so you eat less. This is the restrictive part of the procedure. Part of the small intestine is bypassed, so you don't absorb all the calories you consume. This is the malabsorptive component. The rerouting of the digestive tract reduces hunger hormones and leaves you satisfied with a smaller meal. Advantages to the gastric bypass include rapid and significant long-term weight loss, the majority of which is lost in the first 12 to 18 months. Proven track record for resolving obesity-related diseases, including diabetes and GERD. Patients can oftentimes stop taking their diabetes medication before they even leave the hospital. Disadvantages to the gastric bypass include complex operation, requires vitamin and mineral supplements for life to prevent long-term deficiencies. Gastric bypass risks and complications include internal leaks from the staple line where new connections are made, internal hernias and intestinal obstructions. Dumping syndrome is a common side effect with gastric bypass patients and occurs when certain foods, especially foods high in fat and sugar, move from the stomach pouch to the small intestine too quickly. Although some patients may never experience dumping, for those who do, the effect of dumping is twofold. It may be both good and bad. Dumping can cause the following symptoms: nausea, vomiting, abdominal cramps, diarrhea, flushing, dizziness or lightheadedness, rapid heart rate. On the other hand, if you get these symptoms and don't feel well, you are more likely to avoid the high-calorie foods loaded with fat and sugars. In the biliopancreatic diversion with duodenal switch procedure, also known as duodenal switch, the switch, or BPD-DS, a tubular stomach pouch is created, similar to the sleeve gastrectomy. Then, similar to the gastric bypass, we reroute the digestive tract, but in this case we are bypassing almost all of the small intestine. Now the new tubular stomach or small stomach pouch connects to the last part of the small intestine. The small intestine is reconnected after the bypass to carry the digestive juices necessary to break down food. The switch helps weight loss in the following ways. With the much smaller stomach pouch, you eat less at one time and you feel fuller for longer periods. This is the restrictive part of the procedure. Because so much of the small intestine is bypassed, you absorb significantly less calories and nutrients like protein and fat. This is the malabsorptive component. Hunger hormones are affected, which decreases your appetite, and you feel satisfied eating less. The advantages of the duodenal switch include greater long-term weight loss than any of the other procedures, more effective than the other procedures against diabetes. The disadvantages of the duodenal switch include longer hospital stay than any other bariatric procedure, higher complication rates and risk for mortality than the other procedures, greater potential to cause protein, vitamin, and mineral deficiencies. Vitamins and supplements will need to be taken for life to avoid serious complications. Increased gas and number of daily bowel movements. Duodenal switch potential risks and complications include internal leaks from the staple line where new connections are made, dehydration, intestinal obstruction. The switch is usually reserved for those who are significantly morbidly obese. Candidacy for this surgery is limited and can be discussed in greater detail at a consultation. Bariatric surgery is a powerful, proven weight loss tool, but it's not a magic bullet. To lose the weight and keep it off long term, you must commit to a healthy diet, exercise regularly, and continue to follow up with us for life. Besides improving or resolving obesity-related conditions, reducing future risk for disease, and improving quality of life, you can expect to lose 50 to 90% of your excess weight, often within the first year, depending on the procedure you have and your commitment to lifestyle changes. Here is your step-by-step journey to surgery. The first step is watching the seminar, which you are doing now. We will check with your insurance company to see if you are covered for weight loss surgery. There are also self-pay options available. Our office staff will call you within 3 to 5 business days to discuss your bariatric coverage and schedule your one-on-one consultation with Dr. Proctor. Next, you will fill out your new patient information packet. This packet must be filled out prior to your first consultation with us. At your consultation, Dr. Proctor will discuss the different treatment options with you, so you can decide which procedure best fits your needs. Next, you will need 2 to 6 months, depending on your insurance policy, of physician-supervised weight management classes with one of our registered dietitians. Upper endoscopy or transnasal endoscopy if you haven't had one in the last year. We will schedule this for you with Dr. Proctor. Bariatric psychology evaluation. Clearance from your primary care physician for bariatric surgery. Sleep apnea study. We will give you a questionnaire at your consultation to determine if this is required. Cardiac clearance if you have a history of cardiac issues. To be a candidate for bariatric surgery, you must also meet the following very important criteria. Must have a BMI of 40 or higher, or a BMI of 35 or higher with at least one significant obesity-related condition. No untreated alcohol or drug problems. Be a non-smoker. The surgical criteria can vary depending on your insurance. The preoperative process can range from 2 months to 1 year. To be a candidate for the non-surgical balloon procedure, you must have a BMI between 30 and 40. This is a self-pay procedure not covered by insurance. No matter what procedure you have, know that we will be by your side supporting you throughout the entire process.
Take the first steps to a healthier life with Beltline Bariatric and Surgical Group. As seen on TLC's Family by the Ton, Beltline Bariatric provides both surgical and non-surgical options for combating obesity and weight loss. Beltline Bariatric is dedicated to helping you achieve your weight loss goals while finding resolutions and preventions for your medical condition. Body contouring is also available for those hard-to-target areas.
If you're considering weight loss surgery,
then give us a call today.